Hi, I'm Daniel Love from KORT Physical Therapy. I'm one of our therapists and clinic directors here in Corydon, Indiana, and I'm joined off-screen by two lovely ladies who do a lot of work for us. Kim Frederick is off-screen, and she is one of our business development managers, and Andrea Rechtenwald is here, and she is a project specialist that is key in helping me be live right now. So we're excited that you joined us from wherever you're at on Facebook, or if you're watching this afterwards, we're grateful that you're tuning in. And today we are here to talk about how to keep athletes injury-free and in the game. And as everyone knows, COVID-19 has thrown a lot of things into chaos, and that includes for our athletes. Just a couple weeks ago, we were all holding our breath to see whether any type of official athletics were even going to happen. We saw it at the professional level. Some teams and groups were able to return successfully, and we've also seen some other teams and groups that have not been able to do that. We're continuing to see cancellations, but we're also continuing to see some sports now get off the ground and running. And we are hoping that those can continue for the sake of our athletes and for the sake of just the general population. And if they do, we need to talk about how to keep those athletes injury-free. And that's what we are here to do today. So at any point during today, if you have any questions at all, feel free to chime in on the comments button. We will be screening those. Andrea off screen will be doing that, and if we have some live questions come in, we'll try to prioritize those and answer those. We have had some questions come in already from the other posts that we have done, and so we're going to start out by answering some of those in a few minutes. Remember, as we talk about athletes, the first thing that comes to mind is certainly maybe our high school athletes or collegiate athletes, but we're also here to talk about recreational athletes. So if you're an adult out there, an adult runner or CrossFitter or anything like that, we're happy to answer your questions as well. Parents, if you have any questions, feel free to chime in, and then also coaches. So one of the big things that has happened with COVID-19 that we're starting to see already in our clinics, especially working with high school athletes, is that a lot of these athletes weren't doing a whole lot in spring and weren't doing a whole lot over summer because of all the restrictions that have been in place. And because of that, when they come back and ramp up their training, that is a time that we can see a significant amount of injuries occur from time to time. And we've started to see that here in our clinic in Corydon, and I know at some of our other clinics, because athletes are coming back, they're working really hard because they're really excited to be back. But because that training has been limited over the past 2 seasons, we're starting to see some injuries crop up, and that's something that can happen. So if you're a coach watching, we just encourage you to keep that in mind, that we need to ramp up our athletes slowly if they haven't been active and doing a whole lot, to try to mitigate that risk of injuries. And if you're an athlete, be patient. Your fitness will return. You've just got to give it a little bit of time. So we've got a couple questions to get us started. I'm going to have Kim go ahead and ask one, and then we'll go from there.
What is the most common injury you see in athletes who come into your clinic?
So most common injury for athletes that come in the clinic, it really depends on the season, honestly, especially when it comes to high school athletics. I would say it's a little more common for us to see leg injuries in athletes than arm injuries, at least in the clinic that I'm at. But again, if it's baseball or softball season, that might not be the case. But at KORT, we treat any type of athletic injury from head to toe, and we're more than happy to see you and work with you for that.
Okay. What are some of the easy warm-ups athletes can do before practice or a game to prevent injuries?
Easy warm-ups. So that's a good question, and warm-ups are really, really important. And warm-ups have shifted over time. So 15, 20 years ago, it would have been a whole lot of static stretching. So if I was a thrower, I would spend a nice couple minutes stretching out my arm or things like that, or stretching out my quad if I was a lower extremity athlete. But what we've learned from a research perspective is that dynamic and active warm-ups are really what we want to encourage our athletes to do. And so one of the programs that we have here that we're really excited about with KORT is what's called the ACL Play It Safe program. And we'll put a link to how you can download that in the comment section here for after this. But it's a program that we are implementing at a lot of different high schools. We also use it for our recreational athletes. I use it for adults all the time. But it's a dynamic warm-up that incorporates a lunge position, it incorporates a squat position, and incorporates a knee to chest position. And it's one that's very fluid. It's a lot of motion. It's not static stretching like, again, we used to prescribe in I guess, the old days now. But that's a warm-up that we would more than happily share with you, and would encourage any high school athletes especially to be reaching out for that, because it's one that can specifically help with ACL prevention. Now for upper extremity athletes, primarily your throwers, your pitchers, again, we encourage a dynamic warm-up. So you might have seen some warm-ups that include some TheraBand, some warm-ups that include specified distances for throwing, and those are all things that we would often share with our teams to try to keep them as injury-free as possible. But if you're just wondering in general, make it active, a little bit of mobility work, and just get your muscles prepared to do what they're going to do, which means we need to be moving and sweating and getting your heart rate up a little bit.
Is it better for my child to play one sport a year? Excuse me. Is it better for my child to play one sport all year round or play different sports throughout the season?
Yeah, so the single sport athlete versus multi-sport athlete question is one that comes up, and this is a passion of mine. We all have a tendency to think of our athletes, whether that's our kids or our cousins or our nephews or nieces, or if you're a coach, your kids, and we get kind of these athletes on a pedestal and think, okay, this is the one that's going to earn a D1 scholarship, or this is the one that's going to make it to the NBA, even though the last one that I thought was going to do that didn't. And so a lot of times because of that, when we see talent, we have a tendency to say, hey, you're really talented at this sport, so why don't you give up all of these other sports to focus on that? Because if you do, you're likely going to succeed in this way, and maybe it's that scholarship, or maybe it's going pro, or different things like that. But the honest truth is that more than likely that athlete is not going to get that scholarship. That athlete is not going to go pro. And that's just the unfortunate truth. And what happens is when we specialize, especially at a young age, so anything before probably freshman year of high school, specialization has been clearly shown in research to, one, increase injury risk, but also two, to decrease performance ceiling. And so what that means is, even though you would think that if you've got a 7th grader who has a great arm as a pitcher, and you say, I'm going to get him with a pitching coach, and I'm going to take him to all these clinics, and I'm going to get him to stop doing track and field and stop doing basketball, you would think that's going to develop skills. But in the end, it really doesn't. And the reason for that is multiple sports help develop the body in multiple ways. And sports are dynamic, okay? Even as a pitcher, what we know from just how biomechanics works is a pitcher needs to have really strong legs in order to be a good thrower. It's not all about the shoulder. It's not all about the throws. And other sports can often help develop those areas. And that's something that we really want to encourage our coaches, our athletic directors, our administrators, our parents, to realize that if you want your kid to get that scholarship, if you want your kid to go pro, the vast majority of athletes that make it to that level are multi-sport athletes. It's a very small minority that specialize early on and make it to those levels. And so big time, the final answer to that is keep your kids in multiple sports for sure.
Okay, how important is a cool down stretch after activities?
So how important is cool down stretching? So this is another one that's really interesting when you look at it in the research. And so I'm a running coach. I coach for a local high school here, and we do stretching sometimes as a cool down, but it's not as important as what we used to think it was. And so in the past, that was almost always how you would close out practice, would be a lot of, again, static stretching, long holds of 30 seconds, things like that to increase mobility. And what, again, research has shown is that stretching can be helpful for mobility. Specifically, it can be helpful for problem areas. So if you're an athlete and you're having some shoulder pain, or you're having some thigh pain or calf pain, stretching those out gently can be a really good thing and help you maintain mobility. But the biggest benefit from stretching is actually getting together in a group of athletes and calming down after a hard practice, and that emotional boost that gives. And that's a really cool thing when you think about it from a research perspective. So what I would encourage you to do is, if you are limited on time, And what I do as a coach is if I have to choose between getting a workout in and getting strengthening in, or getting a workout in and getting stretching in, I always go with strengthening. Even though that's not officially a cool down, you're working your muscles in different ways from what a workout is, and strengthening has been shown to be much more important for injury prevention and has been shown to also increase performance measures. Whereas stretching feels good. If you have a problem spot, stretch it out. But in the research, it hasn't been shown to do all of those things.
I recently started running. How much should I increase my mileage each week, and how do I prevent getting shin splints or runner's knee?
All right, so I'm going to reverse that question. We're going to talk about shin splints and runner's knee a little bit first, and then we'll talk about mileage progression. So progression of workouts as a runner is really important, and there's not a set rule. So one of the things, if you're a runner, you might be saying, no, wait a second, I've read about the 10% rule in Runner's World, and that's certainly a rule that's out there, but frankly doesn't have any research backing, and it's something that really breaks down if you're on the lower end of mileage and really breaks down if you're on the upper end of mileage. It's a decent concept to think about, that if I want to get better as a runner, I've got to progress mileage, I've got to progress activity, but I've got to do it in a graded way. And we do encourage that, but there's no set rule, unfortunately, that 10% is a magic number or anything like that. As a coach and as a therapist, what I often look at is not only the mileage, but more importantly, how many minutes are you running and what is the intensity of that? And what we really want to see from both the coaching and therapy perspective is you want to have some longer, harder days, and you want to have some shorter, easier days. And we want to see that mix and match. Mileage is going to go up and down depending on where you're at in a training cycle. The general goal is to progress slowly and then maintain your base. So the worst thing you can do from an injury prevention perspective is to be inconsistent. And so if you were running at 20 miles a week and then you decided to take 3 weeks off and then you come back and run at 20 miles, that's a recipe for some problems. But if you're able to maintain a specific level and then build on top of that slowly, that's going to be the best way for you to progress over time. Now, shin splints, runner's knee, both of those are injuries that have been attributed to poor training. And so that does come back into people doing too much too soon, perhaps doing running in the same areas all the time, perhaps running in the same shoes all the time, different things like that. And so often it does come down to training education when it comes to those. And again, we're in a position right now with the way COVID has been. If you're a high school athlete or a college athlete specifically, you've been shut down for a while. So for runners, don't come back and expect to be doing what you were doing 6 months ago because you haven't been training at that level. Now on the reverse, if you're a recreational runner, that's booming right now because we all got stuck inside and couldn't go anywhere. And then all of a sudden everyone decided, hey, I think I want to be a runner just so I can at least go get some fresh air. And so you guys have probably been running for a bit through all of this. And my main recommendation to you is keep running. Don't get busy with other things. Drop your mileage, drop your time, and then a month from now come back and think you're going to be at the same level. Try to find that consistency in your week, and you're going to have a much better likelihood of not ending up in the clinic with us.
Is there a program that KORT has that helps athletes get back to play once they have knee surgery or once they have a surgery?
Sure. So after an injury, after a surgery, what do we do within KORT to help athletes get back? So a lot of things. The first is rehab. So that's our bread and butter. We see patients after surgeries. We see patients after injuries. And so the early part of that is going to be traditional physical therapy, and that's going to be working on motion, working on strength, and eventually working on function. What we try to do a really good job of at KORT is not just getting you back to walking, but we want to get you back to doing your athletics and work toward that. So we do a lot of dynamic work to help you do that as an athlete, and we are consistently training our therapists to be able to work with athletes at that high level. One of the things that we offer at several of our clinics is called the DorsaV program, and this is a program where we put some sensors on your shins and on your back, and we run you through a really rigorous test. This is another one that we can put a link in the comment section. We have another YouTube video that shows this, and so we'll try to do that in the comment section for you as well. to give you an idea of what it looks like, but it incorporates squats, it incorporates planks, it incorporates single leg squats, and then most importantly, it incorporates hopping. And that's an area where we feel like that a lot of athletes are not up to par yet whenever they get discharged from therapy a lot of times. But that's something that we're trying to help athletes get to. And the other thing that we really work on is true strength and conditioning. We try to have our athletes lifting heavy weights. We try to have our athletes returning to the type of athletic demands that they need to return to in order to return safely for sport. Any other questions? All right, so looks like we are ready to wrap this up. I was told 15 to 17 minutes, and I'm in that window. So we are going to wrap up. If you have any questions, feel free to comment on this after the fact as well, and we will try to reach back out and answer that question specifically on this page. We want to remind you that KORT right now is working really hard to serve our communities, and we're really doing that in 3 different ways. The first is coming in the clinic and seeing someone like me in the clinic. All of our KORT clinics are back open. We're serving patients, and we want you to come in and see us if you have an injury. We're doing a great job of sanitizing. I don't have a mask on right now, but trust me, I wear one pretty much all day long. And so when any patients are around, we are doing our best to keep everyone safe, and so you are welcome to come into our clinics. But the other 2 ways that you can work with this, one is tele-rehab. We have clinicians who are trained to do televisits, so that would be very similar to what you're seeing here. It's set up over video and audio, and we will serve you that way and try to do the best that we can to help you get through any injury that you can at home if that is the safest place for you to be right now. And then finally, we are also offering the third option is home health. Sorry, I had to get a cue there. Third option is home health, which has been huge for us, especially when COVID first started. Our company had a lot of problem getting people in because it was really unknown what was going on. And our home health group has done a fantastic job, phenomenal job of serving patients at home, and that's an option for us to continue as well. Any of these options are available online at www.kort.com and also at our 800 number that's available online as well. And so reach out to us. We'd be more than happy to help you. And if you're an athlete, do whatever you can to stay injury-free. Hopefully you won't have to come see me or any of our other therapists because we'd much rather see you out on the roads instead of in here with us.